My name is Linda Lay, and welcome back to the CV Sisterhood webcast. And today's topic is how to survive as a single mom and surgeon-interventionalist. Our guests today have their own unique and heroic story of their pathway to motherhood, including my co-host, Palma Shaw. The guests are Sheila Kugan at UT Houston, Amy Deipolyi, who's an interventional radiologist at Memorial Sloan Kettering, and Maria Litzendorf at vascular surgeon in modern vascular in San Antonio. Sheila's actually one of my mentors from residency, so amazing vascular surgeon. Welcome everybody to the show, and thank you so much for being our guests and sharing your personal stories of motherhood. Palma?
Thanks for having us.
Thank you, Linda. I'd just like to make a few comments. This actually marks our 1-year anniversary of this series. I'd like to extend a special thanks to Dr. Alan Lumsden for his support. About a year ago, he came to Linda and I with this idea, his idea, of holding a webinar which focuses on topics that are important to women in vascular surgery. Since then, on a monthly schedule, we've been able to cover great topics such as pregnancy and fertility issues relating to female surgeons and many others. This topic is particularly special to me as I've been a single mom since I started my first job at Boston University in 2003. Many of the challenges I faced have served as topics for discussion here. And in this area, there was no role model or clear path to take. I chose to have my son during my first year in practice, and it was very difficult to manage childcare coverage and expenses since call was every fourth night, and I had to find a way to do that and provide him with the care that he needed. When I was pregnant, I didn't have anyone who could take me to the hospital when I went into labor. So the cardiac cath lab nurses took turns taking call, responsibility for who was going to take me in if I went into labor. So also, once I had my son, an infant son, I would go check on my patients at night. So I'd lug him into the hospital, and often the residents, and Maria may remember as my former resident at BU, they would watch Paolo for me while I would go sneak around and check on all the patients. So the funny thing is even Tom DeVinagracia, who was my resident at that time, is now the chief of vascular surgery at University of Connecticut. So it's funny how you engender support from the people around you. And I couldn't have done that without so many acts of kindness. I really want young women to know that you can do it all. You can even have a child, be a single mother, and become a successful vascular surgeon or interventionalist. Now I have 2 great kids. My son is 17 and my daughter 13. I have a busy clinical practice and am an academic vascular surgeon. So I'd like to hear from these women, their beautiful stories of path to motherhood, as Linda said. And we're just really happy to have you here.
Yes, and just to review some of the recent statistics. So in 2015, there were actually 13.6 million single parents in the U.S. And out of those, 80% are single mothers, of which 50% of those are actually working. So it's not just in the medical field, it's nationwide. And there was a study out of Mass General published in BMJ, and y'all will find this funny, 2015. They looked at the divorce rate among physicians and other healthcare professionals. And actually, contrary to what everybody thinks, we have the lowest rate of divorce well, I guess other than pharmacists. So the rate of divorce is 24% in physicians. So it's lower than any other profession. However, female physicians are 1.5 times more likely to be divorced, especially those who worked more than 40 hours. But men were the opposite. So if they worked more than 40 hours, they were less likely to get divorced. So I don't know what that means. I don't know what to take from that. Maybe their wives don't like them that much, and if they were home a lot, it might get bad. And another article in JAMA in 2017 looked at perceived discrimination by physician mothers. And out of 5,800 respondents, 36% of those women felt maternal discrimination in their job. And so, it's a real thing, balancing your career and your personal life and your children. So we'd love to hear each of and every one of y'all's stories and how you overcame that and got to where you were. We can start with Sheila.
Okay, I guess maybe I'll just start with sort of my story, and that is that I was working in another state. I was at Stanford. I was a vascular surgeon, and I was in a book club, and my book club was a group of professional women. None of whom had, some had kids, some were married and had kids, and some were still single and hoping to get married and have kids. And one woman at the book club brought up, "Hey, have you frozen your eggs?" And I said, "Well, I don't know if that works." So I asked a guy I had dated in the past who was a fertility doctor in another state. And I said, "Hey, Mark, what do I need to know about fertility?" And he said, "Well, the leading cause of infertility is maternal old age." I said, "Well, what is that?" And he said, "Well, that's 37. I said, "Wow." At that time, I would think I was 36. And so then, I'd obviously dated a lot of different people over the years, but not Mr. Right. So I decided to freeze eggs and freeze embryo when I was about 36. And then when I was 39, I was talking to a friend of mine who was trying to get pregnant, and she was 40 and she wanted to have kids. And she said, "Well, I'm just at this place where now's my time." I was like, just so you know, you're already on the end of that bell-shaped curve of motherhood, since most women are having kids in their 20s. And as I said it, I was like, I'm 39. So when am I going to do that? And so at that point, I decided to use my frozen embryo to try to have a child. And I have one really amazing kid out of something like 37 frozen eggs and embryo.
Wow.
So feel very lucky.
And your kid is now how old?
Yep. So my daughter's 14. And I can tell you that, I guess we talked about fertility on a different episode. I will tell you, I was raised Catholic, and so it was a big trauma for my father, especially. How was his, daughter having a child out of wedlock as a single mom? And my mother actually was just like, "Great, bring it. I'd love a grandkid." So it was really interesting to see my parents' response. But overall, honestly, the truth about children is every child is loved. And it's really interesting how that is less of an issue once they're in the world. I would say the world loves children and wants to support children by and large. So
great advice. And Amy, what about you?
I have a little bit of a similar story. I'd always had like having a family on my sort of bucket list, but it wasn't something like driving my every move. I dated a bunch of men, never found the right one. And when I finally got my first job, I finally had the resources to be able to freeze my eggs. And I was like, well, I'm 36 now, I better just do it as an insurance policy. And I remember meeting with the doctor, and he had the statistics, and it was like, even with like this many eggs, you only have like a 50% chance of having one child with that. And I actually started crying in the consultation. I'm not a big crier, so it was like, it just hit this deep chord with me where I guess I hadn't realized like consciously that this was something that I really wanted. And I was like apologizing. He's like, "This is very common." So I just feel like that was always something that I guess I really deeply wanted and didn't even realize until I did that. So then I had those eggs on ice, and I'm going along, I'm living in New York City, dating all these guys, all these different, never met anybody. And when I hit 40 years old, I'm like, well, now's the time. So I chose a donor, and I fertilized all the eggs, and I have a 2.5-year-old daughter now. And then actually just recently, she's the best thing I ever did. So I decided to have another one. At 42, I collected new eggs, as beat the odds, and I got one more daughter who's now 3.5 months. And I would say, I have family sort of in the region, but not close by. So I'm almost entirely dependent on my nanny for child, like the support and, helping me raise them. And it's been very tricky kind of figuring it out, especially during COVID. Just like, I don't know, my boss, who happens to be a man, said that, what I needed was backup nanny. And I was like, what does that mean? Like, would I pay someone not to work to wait to come in? Like, I'm not even sure what would happen if, she got sick right now. So it's been tough, but very rewarding. They're beautiful. I'm glad I did it, but I'm definitely sort of still in the phase of working through it and how to support them and create the best environment for them since they're so young.
Well, congratulations on the new baby.
Thanks.
And then Maria?
Well, my story is a little bit more mundane because I did it the other way. I got married when I was a resident. like Palma said, she was an example of, I think the only example that I had seen of I almost want to say a female surgeon, but there were a few other female surgeons, but certainly the only one that I knew that had a child. But I got married, met my now ex-husband in residency, and had my child my senior year as a general surgery resident. And I mean, I can attest to all of the struggles that I think Amy was talking about there regarding childcare. I think I must have gone through so many different nannies and variations of help, at paying people to be on call, paying people then because I didn't trust that if they were late and you have to go in, you can't wait for them if they don't hear you, to just have them stay in your house. Until my mother finally moved in with me because she couldn't, I think, deal with one more frantic phone call of me saying the last person. Again, like I would get little sticky notes on my counter, they checked out, and I would come home. You know, you can't rearrange everybody else's life at the whim of any of your babysitters. So finally, when I had my daughter, who's now 8, my mother came in, and she's been pretty much a constant source of support for me. So I feel very, very lucky. But those first 5-6 years with my son were a constant struggle.
Wow. That, I can't imagine. I'm very lucky to have lots of childcare around that. So that would stress me out to the extreme, which I'm sure it did for you.
I think childcare is one of the single hardest issues for single moms, but also just for even two parents who are working parents. And I mean, specifically for me, I'm eternally grateful to one nanny I had who very early on came, and she would show up at 6:30 in the morning, and she would stay with me until whenever I got home. It could be 6 o'clock at night, 9 o'clock at night. And for the first 6 weeks, my partners did not put me back on call when I returned. And so I had sort of a 6-week window to sort of figure out what my nighttime coverage would be. But she just stayed. She would stay till whenever. I couldn't believe it. Her husband would be waiting outside of my house in his car, and I'd say, "You can bring him in while I'm running late." He'd say, no, he can wait in the car. But she was terrific. And then for about until my daughter went to kindergarten, I had 2 nannies. I had a daytime nanny and a nighttime nanny because I was on every other week, and the weeks that I was on call, I was 24/7. So I was used to having almost full-time coverage. That was quite expensive, but it was very easy in that regard. I would say, actually, unfortunately, Amy, I think it gets harder as your kid is older because they have more places they need to be driven to. And especially, I had 2 great nannies, but neither one of them drove. And so that was a very big limitation. So that has been an ongoing issue with the afternoon person who will drive my daughter places, after school, so that she doesn't miss out on other after school activities where I need someone who can drive her. That person has been an ongoing sort of turnstile kind of situation. And when you lose somebody, you're right, it's like a full court press and a full-time job. So stability in childcare is probably one of the single biggest issues, I think, for any parent, especially 2-parent working families or single moms.
Yeah, and I have this idea that if I weren't in New York, I could get an au pair and that would solve all my problems somehow, because then at least someone would be living there, and there'd be more flexibility in the evening. But yeah, I having grown up in Connecticut with friends with a bunch of live-in nannies with various sort of horror stories about these nannies. I don't know, it's really complicated.
Yeah, I don't think there's a one-size-fits-all. I think everybody finds their path for that, but it's definitely a challenge for everybody.
Mm-hmm. Well, the au pair thing isn't really that big a help when we have call, because they can only work restricted number of hours. So I looked into the whole au pair thing, and then most of childcare was way beyond what I could afford when I was working at BU. And so I lucked out. I would have nightmares every night worrying who's going to watch this kid, who's going to watch this child. My family was in Philly, I'm in Boston. And then one day, one of the secretaries says, "Hey, my neighbor runs a daycare, a Dominican daycare." So my son became her 4th child. So he had a room, he had a crib. Every night I was on call, he slept there. When I was on a full weekend, my little baby was at the Dominican nanny's house. I mean, you know what? He had a good time. He learned some Spanish, you know. She would make his food from scratch. Way more than I would have ever done. I was like, here, have some Ensure, you know. I was like, I'm not cooking. But she would like make his food from scratch. And then I had her for like 5 or 6 years, and it was incredible. And I never worried, like I could come home anytime late. It was incredible relief. Like that panic you feel when you're like bolting out of the hospital and you're like, oh my God, I got to get home. And like, it's the worst possible feeling. And and so then I had to change to a dish. She couldn't do it anymore for a different reason. And then I found one other family, and then they were like my extended family, and I had like a team, a husband and a wife and their daughter. So it was like Team Askew. So like the father was an early riser, so he would come in the morning and stay with the kids and take them to school. And then the wife would come in the evening. And then when they couldn't do it, the daughter came. And I needed like an entire team, you know, to manage one child. And then when I had my second daughter, I was temporarily married and then quickly divorced, but I got her out of that. It was a good move. And then I was juggling 2 children in different childcare, but everybody has to find their own recipe, and that's why it's so stressful, because nobody can just kind of give you the algorithm. But then the funny thing is, like, they just show up, right? I don't know how you feel, but like all of a sudden you found this person, and they were like an angel that came into your life and was good to your kid, and all the things you worried about didn't happen. So I don't know if you had that experience. I know my mother's with me now. I know Maria, her mother's like saves her with her daughter and her son.
She does, but I mean, like you all are expressing, it's a 24/7 job, and my mother's getting older, so it's a lot harder. And certainly as they get older and then they have activities, that's a lot to ask somebody else to do when there isn't another parent that's there that can shoulder half of those responsibilities. So I definitely think, I mean, like you said, there's no real recipe. I've done the au pairs, I've done the multiple and you're right. I mean, God knows I have friends who have found the perfect person who was willing to, you know, work, and they were very flexible. But for me, it's always been, I need to have like 2 regular people plus a couple backups, because invariably something will happen or change. And it's really hard to come up with somebody, you know, at the last minute. So at least now with my mom, I do have that flexibility. I'm not worried about the overnight coverage. I think that's the most stressful.
Do y'all think that, you know, going through these issues has affected your career advancement by any, you know, chance or by any means?
I think so. Like, I think that, oh, sorry, Sheila.
Go ahead.
I feel like a lot of even just like bonding with colleagues, like being able to go for a beer after a stressful day, it's just like that evaporates, because you can't be spontaneous anymore. You have a whole set of responsibilities, and you just can't be part of that team. I've become like much more efficient in my day, so I feel like my productivity is similar, but I do wonder about, I think there is a
I was going to say, I think what happened to me was when my daughter was very young, I had complete coverage. So I could go to evening meetings. She was young. She would go to bed early. And as she got older, actually, it became different, where she would notice that I wasn't there. I had someone who I ended up not needing the daytime nanny because she was in school. And so then I just had a nighttime nanny. But I still, in fact, have a person who comes at 5:30 every day and then stays until 9 o'clock in the morning, and also stays Friday night until Saturday morning, which if you don't have that actually is a huge benefit, because you have a little bit of time on Saturday to go grocery shopping or get your hair done or do other things that you wouldn't have if you were just by yourself, and you would be less efficient with a kid underfoot. So, but what happened to me was I stopped going to dinner meetings, and I stopped participating in afternoon or evening things, because it was time away from my family time with my daughter. So although I still go to some of them, I participate in far fewer. And I mean, honestly, I used to say, I'll just show up for dessert. Like, I'll show up at 8:30, don't wait for me. And honestly, at 8:30, they were just finishing drinks. So I was like, I can't believe I'm going to be here till 10 o'clock at night. But, and then also my program was, for a while, a lot of the management and the organization was done by a single guy who was managing a lot of the administrative meetings, and he would schedule resident interviews on Saturday morning. And I was thinking, is there no other time? Is there no other day? And so at some point I just decided that, you know, my input was less important since other people were weighing in, and I opted out of that. So I think it's impacted my ability to be present for some of those things. Do I know that that impacted my career advancement? I don't know, but I do know that I opted out of things that I normally would have been more visible at, just because it at some point wasn't worth it to miss out on the other part of my life.
Yeah.
I think it hurts. I think it affects you getting a job. So I'm on my third job. And when I was in Boston, one of the reps said to me, hey, I told so-and-so he should hire you because out of BU to leave BU and go to them. And he said to her, is she done having kids yet? So clearly he accidentally spoke, but that's what they think. They're not going to hire some single mom with kids. You know, why wouldn't they just hire a guy? They're concerned about your productivity. But I actually think that they're going to wake up and realize that the younger generation isn't going to do what they did anymore. It's not because you're a man, you're a woman, the men are going to want the same time off. And a lot of the men now want time with their family. So I think that there's going to be a new balance evolving as far as that.
Yeah, I see that happening for sure, especially with this whole wellness being a vital importance in their training and work hours limitations. It's definitely going to change. I don't think we're going to be interviewing on Saturdays much anymore. Well, I mean, Methodist doesn't, but and I forgot to mention.
Might miss an OR day.
I know, God forbid we miss an OR day here. I forgot to mention questions. Since we are live, you can join by the web. You can go to pollev.com, enter DEBAKEY, and send your questions in, or by text. Text DEBAKEY to 37607. That's 37607 to send in your question, and we'll answer them live while we're here. Any advice to young women who may be considering being a mother? And maybe either having a partner or not having a partner, but just in their young career?
Well, I've given advice to a couple of people, and one of the things I say is, I mean, I think it's true that sometimes women are stereotyped as they just are out about their career, right? They're not interested in family, and I think that's a really false stereotype. I mean, just because you have a big career or a career that might intimidate people, it doesn't mean you're doing that to the exclusion of family. But I also have advised people not to think that they can just have the family when they want to have it, because fertility is a real issue. And so I know you discussed that on a different episode, but I just think, you know, it's not like you can just decide when you're 40 that all of a sudden you're going to have kids and be successful. There are a lot of people who have infertility issues that they don't even anticipate. And so I think one thing is, actually, it's kind of funny. I think what's a really good idea for everybody in life is to sort of make a timeline. Like, okay, when do I think I should be a mom? When do I think I should be a dad? When do I think I should, you know, I think those are useful things. And they actually talked to my daughter in her class about this sort of, well, for life planning, for other things for teenagers, but I think it's actually a useful way of thinking about life. And I think if you create a timeline of what's the right time to do this, most people wouldn't say, okay, I'm going to start having my kids when I'm 38. That's probably not when most people would choose it. Although when you have a career, especially a surgical career that requires training to 34, 35, that is not uncommon. So, but that's also the same time when fertility is a real issue. So I do think people need to anticipate that. I also would say we have a fellow currently who had a child, and she's a 05 fellow. So I think people are thinking about this, and there are certain people who are really sort of, you know, already married, having kids now in training. And I think that's really positive because they aren't postponing things that are sort of normal life cycle times.
Well, I was saying at one other show, I said that, you know, when I moved to Upstate and I wanted to apply for one of these travel scholarships with SVS, and I was 46, right? So they're like, you're too old. I'm like, oh, I'm too old now. So now I had this whole section of time where I was having my first child, having my second, it was like a survival mode for such long. I finally get to a point where I could actually do this, right? And now I'm too old. And I don't think it's fair. I mean, I think that women many times have to put, at least on a plateau, their ascent in academia. Maybe you can't write as many papers. I can't go to as many meetings. I can't give as many presentations because obviously I'm changing diapers and doing formula and doing 100 other things, obviously. But then I can catch up. I can catch up later. But the societies have to permit us to do that. They can't just cap us and say, now you're just too old. We're going to put our time into younger people. I've found that to be unfair. I don't know if any of you had a similar experience where you felt like your career advancement was really not, you weren't able to make things up because you took time with your child.
Maria, Amy?
You felt like you went right through everything. I feel like I plateaued for a while.
I mean, I think of like, if anything, I'm like, I'd be in the middle of a plateau, and sometimes you don't see it until you're looking back. But, hopefully it won't do that. I will say, like, having two of them is like, it is a sort of much harder than the one. So I was able to continue to publish papers and do things, and I guess time will tell going forward. It's I'm in an academic job, and I feel like the key to my success is going to be to have some protected academic time, because without it, right now the nights and weekends are just like really full of childcare. So I don't know. I guess we'll see. Check back with me in a few years about whether I've plateaued.
Like Sheila and I are in the phase where the kids are kind of like, "Oh, Mom, you home? Okay, good. I'm going back to talk to my friends." They just need to know that you're there, right?
Yeah.
I try to get in her face and say, "Hey, I'm here. Let's go spend some time together." And she's like, "No, I'm good on my computer." And so I'm like, I don't feel guilty because I'm on my computer.
Yeah. But your children, Amy, are really small right now. So you have to, I look back at pictures of my kids when they're so tiny, and I'm like, oh my God, they were really so cute. And then you don't want that time to go away. So you need to be able to enjoy that. And then when they don't want to be around you anymore, you wish they were back. You're like, okay, now I can write that paper, or now I can join that committee, or I can do that now. But
no, I think actually my timeline advice though, Amy, I think it's actually really critical for you to think about what your timeline is for those goals, because truthfully, what happens a lot of times to all of us, and especially with families, and look, I think managing a kid and managing your career is not that hard. I think running my house and a job and my kid is really hard. Like the household stuff is the part that just, you need your roof fixed, or you need your sink goes out, or your refrigerator breaks. That's like a whole other thing, and so you're never going to for me at least, I never let my daughter suffer, I think, although she would tell you I ignored her many times when I wasn't there to pick her up from carpool. But I mean, I think that she was always a priority, and I think just maintaining work was a priority, but then I think the house stuff is just a whole other third job. So I think, but I do think the timeline is kind of useful because it'll keep you focused on where you should be programmatically. That's really hard to do because you're just focused on, if you're just focused on each little thing, it's hard. But if you have a career timeline, it might be helpful.
I think
what I would add,
oh no, go ahead.
Add, from my perspective is, there's more than one way to do things. And we're talking to some colleagues here who are very academic driven and might have those clear guidelines or what they want to succeed in and what they want to accomplish in their careers. And there's no one right way to do it, right? You could be a surgeon, you could be an interventionalist, you can do it in many, many different ways. And I guess that's what I've seen over the last 10 years is I've seen a lot of examples of women who are doing it many different ways. I've seen some women that I wonder, my gosh, how are they getting up at 4, running 12 miles, having 2 kids, being a general surgery resident? That's not something I would want to get up and do in the morning. And they managed to put it all together. And I guess what I would say is, not everybody has to do everything, right? You can pick and choose, and what might be right at one point in your life might not be right at another point in your life. And you can kind of shift that where you can feel happy with what you're doing with your kids, because like the rest of you were saying, at the end of the day, they're the ones that are going to be talking back to you when you go home.
Yeah, and I think there was a study, speaking of household chores and things, like looking at physician women versus men, and we actually women do 8 hours more a week of just like whatever you want to call it, household, keeping up the house, domestic things. So I mean, and 8 hours is somebody else's regular work day. So that's crazy. I mean, if you could have 8 hours to do whatever you wanted, work on papers, hang out with your kid, that's a lot of time. So and
I actually, like, to your point, I guess my one advice would be, or something that helped me, I hired extra help. So to like invest more money in like getting help. So, and I think like there was some New York Times article showing how like for a doctor, it makes no sense for you to be spending your time like doing laundry and doing things that you can like outsource, even though it seems costly, because your time is better spent either with your kids or doing other things for your career advancement. So I don't know, that's been sort of helpful. I was very fearful of hiring someone in the time of COVID, just bringing another person around the kids, but it became essential to just have the help on the weekends.
Yeah.
So the nanny like watches them while I go like grocery shopping and cook for the week. So like I have someone to help me with the kids so I can run the household.
So my nighttime nanny is the same person who's been with me for 14 years. She comes at 5:30. She cooks dinner if I'm running late. She used to just cook rice, and now she cooks miso glazed sea bass. She cooks baked Brussels sprouts. She stays on Wednesdays all day and does all of my housework during Wednesdays. So I do almost none of that basic housework, but which is lucky for me and lucky for my house. But there's still a lot of troubleshooting things, just running a household that you have to make decisions on, and just household maintenance. So
I want you to tell us what you did to keep someone for 14 years.
Honestly,
that's what we need to hear.
I can't tell you. I really, the best thing you can do is find a good person, because you can pay more money or less money, but it really is about a good person who's really committed to being that person to support you. And how I came across her is very random, but she just happens to be a very, very good person. So we're very lucky to have her.
Wow. So Sheila, I know we were talking personally, about your pathway and how you handled certain hiccups in the road. And, what do you say to your kid when they ask about, a father, or, where's my dad? Because I remember you telling me like your child got bullied at like age 7. And I just thought that was terrible.
I mean, one time she was on a swing and someone was pushing her. Another girl's nanny in class was pushing her on the swing, and my mother happened to be picking my daughter up from school that particular day. And so my mother was standing there, so my daughter's grandmother, and the other nanny was pushing both girls on the swing. And the other nanny's, the other girl said to my daughter, "Your daddy must not love you because he never comes to see you." And so that was just heartbreaking to hear. And and also my daughter would be in the car, like when she's 2 or 3 and they're in school, they'll say things like, "Where's my daddy?" She would say, "Where's my daddy?" and throw her sippy cup at me. And then I'd say, "Well, your daddy, you have a dad, but he's not here," because apparently every kid needs to feel that they have sort of the normal family unit. And so I would say that, and then I'd say, "Do you want to know more?" And she'd say, "Look at the tree." She would just be off on it. So at a young age, they have sort of a very limited attention span. And then when the other girl said that to my daughter about, "Your dad's not around and must not love you because he never comes to see you," I told her the story. And kids can only take in so much information at a given time. So I said, "Look, your dad is," when I wanted to be a mom, and I asked the doctor if they could help me be a mom, because I really knew I could love a child, and I had this in me to love a child. And then I ended up finding someone to help me have a child, but I never met your daddy. And so I started off with that. And so she got it. And she knew that from the time she was about 4 years of age, from the time this girl said this to her on the swing. And I think it was very weird for kids, because especially in preschool, there are not a lot of divorced families early on. Everybody has this sort of typical family unit, or a lot of people do. That was very hard for her. But at this point, I think it's kind of the status quo. I think I think mostly for almost every child, I want for me and my daughter, and I'm sure for everybody, they want their children to know that they were loved and wanted, and that, I don't know, I guess just, that she is normal, right? They want to be normal. They want to be like other kids. But I had to explain why her dad wasn't around. So
it's hard because so my son's father's not, I mean, we get along, but he's not involved, and he's really never been involved. So I just did everything. But, and so my son, I always felt bad because my sisters had great husbands, and those husbands were playing softball or baseball or out throwing the ball or working with their kids. And I felt always a little bit bad that how much more could I do? I'm working full time. I'm running this house. I'm trying to keep things, working, maintain my career. And yet I can't be that extra person that takes my son out, to go play ball. So, I do think that there's things that he didn't get an opportunity to do. I feel kind of bad about that. But the reality is he's fine. I mean, he's like a mama's boy, totally. And so, I get like 5 hugs a day, and he's 17. So, whereas my daughter is more like, Mom, I'm totally done with you. And because I'm like 13 going on 18, and all I care about now is my friends. And yet her father, my former husband, is like helicopter dad, totally like everything, almost, suffocating. So I'm like the easygoing mother, which probably nobody that knows me could actually believe I could be easygoing. But anyway, yeah. And so I don't know. I think that the best thing, and I know Sheila said earlier, like kids are resilient, and I really think they are. And at the end of the day, they just have to feel loved, whether it's by mom, and my mom lives with me, so she does all the house and runs everything, and I'm extremely grateful for that. So kids just need lots and lots of love. It doesn't have to be like mom and dad. It can be mom and grandmom. It can be mom and Aunt Susie or whoever. Just tons of love. I mean, lots and lots of love. I think that's the magic ingredient.
Well, that's great advice. We have a question. The question is, looking back, would there have been an ideal or easier time in your schooling training for you to have had kids? Or do you feel that it was better for you to be more established in your career by the time you had children?
That's a question. It's like, it's challenging. Amy, what do you think?
I mean, I don't think like for someone in their career that there is a good time. Like it's just always hard. I think like to Sheila's point, it's easier the younger you are just to be able to have children, and you have more energy, and you won't be super old when they're, teenagers like I will be. But yeah, I don't necessarily think there is like a specific easier time. Although I will say that being more established is helpful because I do have more income. So like I was talking about getting nanny, I'm like totally dependent on babysitters and nannies. So I don't know that I could have even afforded the, egg retrieval and the nanny until I was an attending, which was when
let's talk about that. I mean,
that's right. We needed to
I went to get, when I was physically healthy, I was like hiking, running when I was at Stanford. And when I went to get the medicine to do my first fertility treatment, it was like $12,000 straight up. And that was just the tip of the iceberg. And I was like, holy cow.
Yeah.
So, I wouldn't have ever chosen to be a single mom until I was older, because I didn't anticipate being a single mom. I just got to the point where I decided that I wanted to be a mother, and I had loved to give a child, and I wanted to explore that and to enjoy that, and I'm glad I did. But I kind of always thought I would approach that in a more traditional way. So I think it's hard for someone at 25 to say, sure, I'm going to be a single mom. That's a sort of an irrational choice in some ways, but I don't know the right time that someone would pull that trigger. In retrospect, if I knew that I was going to be 39 before I started my IVF, before I got pregnant, I probably would have done it at 25, but hope springs eternal that I might have met the right guy to make that a slightly different arrangement. So hard to know.
And Sheila, didn't you say that like there was some insurances that do cover, like that was one thing you didn't realize to look into?
Yeah, I do. I mean, my insurance, and I don't know that either institution that I worked at covers that, but certain insurance policies do cover various types of fertility. So I'd say if you're thinking about fertility treatment, I have a friend who works in Arizona for a large auto leasing company, and her insurance provider covered fertility treatment, including IVF. So that's very variable depending on where you're working. I don't know if that's true for any medical institutions, but before you embark on having children, it's good to know what's covered. But yeah, kids are expensive.
Yeah.
No matter how you have them.
And sometimes you don't do it on purpose, but that's just how it works out.
That's right.
And I remember when I found out I was pregnant, I can't tell you how many women, for some reason, just started to pour their hearts out to me that they had been through like 8 years of fertility treatments and never had a child. And it was weird. It was like, all of a sudden, all these women are telling me these stories. And I was like, okay, I guess this is a good thing, so sometimes things are just meant to be,
I will say one thing, which was really interesting to me when I had my daughter. I think if you're a single career woman, nobody knows what to talk to you about. You're just a single career woman. I had a lot of friends not in medicine. So, those people would sort of ask me some questions about medicine and then start this other conversation. But I will say when I had my daughter, all of a sudden, it normalized me in a way to the rest of society that are non-medical necessarily, or even to some medical people, where all of a sudden they could ask me about my daughter. And there was this commonality that I had with people who are not necessarily career women or people who are outside of medicine. It didn't just keep me in this sort of pigeonholed career woman slot. And I hadn't expected that. It was really interesting to me that happened.
But I still feel like if you go to these like moms things, like I remember I went to it was a grade school thing, and they're like, the mom showed up and I'm there and there's like 5 other women and the kids are real young. And so they're like, okay, well, you're all going to meet each other. And they're like, what do you do? And I'm like, what? They're like, I do, I don't know, whatever they did. And I'm like, I'm a vascular surgeon. And they're like, it's like crickets. No one, nothing to say. Yeah. I'm like, okay, next. I always found it hard to find things to talk about, because I don't know, we're just in our own little silo, I think. So.
Well, the school where my daughter is very near the medical center. So there are a lot of physician families and including a lot of career women, many who are extremely accomplished. And, I think it took me a while to get that chip off my shoulder. Like I had this ego about, well, I work. Because I'd see all the tennis moms lined up, they drop their kids off in their tennis skirts and go play tennis. And the reality is I'm so grateful for the tennis moms because they took pictures of my kid at the, American History Project and sent me a picture of my kid. So, I have to say, and they were the ones who were leading the field trips and bringing snacks and helping in ways that I wasn't able to. So I actually have to say it took me a while to get that chip off my shoulder. And in retrospect, I realized what a jerk I was for sort of having that attitude, like I work and you're all playing tennis. They did a huge amount for my daughter over the years. And I'm so grateful for the moms who aren't working and who are really invested in taking care of the kids at school and helping out in ways that I'm not available to do. So I feel bad in retrospect. I really had such an attitude. And the moms that have helped me over the years with my daughter and sent me pictures when I can't be there and whatnot have been incredible. So I'm so, so grateful for them.
Well,
we have neighbors. I have neighbors that have done that, and it's not that I ever had an issue with any of the people. It's just that you really run out of stuff to talk about. You say a few nice things and talk about the kids a little bit, but I don't know. I just feel like I spend about 90% of my entire life in medicine, so maybe I'm just not diverse enough. So.
Well, one other thing that happened to me is I moved to a timeshare, a multi-specialty clinic where I was around a bunch of non-surgeons. And in fact, that has also been really helpful to me. It was helpful to me both in developing a vein practice because I was interacting with all the internal medicine doctors and family medicine doctors. But it was also really helpful because they had issues that my surgical colleagues just didn't have. I wasn't going to talk about schools or childcare or activities with my male colleagues. In fact, even though my male colleagues have children, a lot of times they're like, my wife deals with that. So a lot of times, they just didn't have any input and it was not a common conversation. But I will say that even that was sort of an unintended consequence of moving to this multi-specialty clinic that I thought was sort of being banished from the kingdom. And it gave me a whole group of friends in medicine that are non-surgeons, but that I really identify with. So that also was extremely helpful to me.
Maria, did you feel that you were able to connect with some of your children's friends, moms, and things like that?
I saw, I've moved a lot. So I think I've seen it on both sides. I've seen You know, on the rare occasion when I could walk my kids to the bus stop, I've seen the tennis moms, and frankly, I've been jealous. They're in awesome shape and they're about to go work out, and you know, they seem pretty relaxed. So if anything, I've struggled more with feeling jealous and feeling guilty that I'm not doing enough at work and I'm not doing enough at home. And, you know, and then Palma, like you've said, I mean, I've been around in other situations too, where my mind has been more at work, I think. And then I haven't had the time to be able to let myself relax and talk about things and find some common, common things to talk about, other than, you know, the kids are playing here, the kids are doing that, where you can actually develop those friendships. So I guess I've seen it both ways, and I think what's impacted that mostly has been whatever stressors I have felt from my work life, to be quite honest. So when I have felt less stressed about that, I've been able to open myself up to that a little bit more and relate to, you know, the moms. But yeah, I've seen it both ways.
We have one last question from the audience. I like Dr. Palma's suggestion about how societies can support women by allowing them to engage in activities at different stages in their career and not be ageist. Any other suggestions on what surgery departments can do to enable fulfilling careers for single surgical moms? That's a good question, a hard question.
So when I was in Boston, I met this woman, I don't remember her name. She's a woman of color, and she was a president of one of the small colleges in Boston. And I got invited through, I forgot who invited me, to go to this dinner with some of these women leaders and such. So I went. And she just was talking one day, and she said, you know, she was a teacher, and I said, well, how did you become a president of a college? And she said, well, I was driving my son one day, rushing here, rushing there, you know, trying to get him to some appointment. And we got into a car accident. I realized that I got into this accident because I wasn't focused on what I was doing, because I was doing too many things. So I took a step back, is what she told me. And I said, I'm gonna get through this phase of my life, and then I'm gonna catch up. And that's exactly what she did. So we, just like AAA, aortic aneurysm, stepwise growth pattern, she felt that women's careers can be stepwise. So we can, you know, have a really steep trajectory, and then we can plateau. We can have our kids. We can be a mommy, you know, like especially the first, you know, 10 years of your kid's life. I mean, you want to be there with them when they're really little and they need you. And then you can jump back on. So I'm sort of on the up now, I think, anyway. But I think that people need to be open-minded that this is okay, and that you just can't say, well, you're 46, not 45, and you can't win that scholarship because you're over the hill and we don't want to invest time in you for your career. I think societies need to be more open-minded to this.
Well, I don't disagree with that. I think I have a slightly different take on what I think people can do. I actually think that if surgical societies and surgical departments want to be more productive, what they should do is give people protected time on weekends and after hours. I mean, I do think that that's not true for women only. I think my male colleagues would have happier marriages and better family lives if they spent more time with their families. I think that if you have a weekend off and you get to spend that time with your family and your kids, you come back refreshed and ready to work hard. Mm-hmm. And in fact, that's supported in the evidence by Microsoft Japan, giving people 4-day work weeks and having increased productivity with a 4-day work week. So this idea that you have to work 7 days a week and then you're going to be more productive is actually just false. In fact, people get burnt out. We know burnout is a huge issue. And I actually think that if people really thought about the data, especially this Microsoft Japan data, where the single biggest thing they did was give people an entire day off and they were more productive, people would start to refocus on not having meetings after hours and not having meetings on Saturdays. And in fact, thinking about, hey, maybe you need Friday afternoon off, or maybe you need Friday morning off. Take that time off, and you don't have to work an 80-hour work week. Maybe we're kidding ourselves. Maybe the 80-hour work week is not very productive after all. And I think that doesn't apply just for women. I think what's good for women is probably good for men too. Mm-hmm.
Yeah, I agree.
A lot of work done at home. If I had a half a day off, I'd be like at the store, I'd be like taking my car in to be inspected, all the things you can't get done.
Right. Yeah, I agree. I mean, I think other specialties, they don't have meetings on the week. I mean, they don't expect to have meetings on the weekends or at 6 a.m. in the morning or 8 o'clock at, 7 o'clock at night and all these dinners. That's all, to me, extracurricular, and that's time away from my daughter and my family. And so I think it should be all geared towards during the week, during the working hours, like every other specialty, because it really does. I mean, if you're in the OR all day and you get to work at 7 a.m. and then you're there all day and then you have a dinner at night, well, guess what? You're not going to see your daughter at all. But then what if the next day you're on call? Then you're not seeing them for like 2 days. So I think, I agree with Sheila that there needs to be protected time. It needs to be more of a, I don't want to say 9 to 5 because, with surgeons we operate at 7:30, but it needs to be less of a weekend and after hours gig, because even with residents as well, and they have their work restrictions, but many times they'll have journal club, they'll have journal club one evening, then another evening they have a dinner, and then one morning they have, it's like a constant thing. So if they have families, they're not really seeing them either.
But I also really want to emphasize that I don't think that's just good for women. I think that's good for everybody.
For everybody, yeah. Yes, I agree.
I think it would be helpful too for like on a department level if they're more flexible about allowing people to go part-time and then come back to full-time, like have more flexibility in being like a full FTE versus like 0.8. And I think some institutions kind of allow that, and that's can be very helpful to be able to do that for a short period and come back.
Yeah, that's also very good advice. Any last comments before we wrap up?
I just want to say that being a single mom was a really big leap of faith for me. And it was the best leap of faith, and it's the most radical thing I've ever done. And it was the greatest thing I've ever done. But it's really hard. I would tell you that even though people can look and think that they might think that we're successful every day, it's just a series of compromises, and it's pretty hard. And it's harder than I thought it would be. Is it the best thing I've ever done? Yeah, it's the best thing I've ever done. Is it one of the hardest things I've ever done? Yeah, and I feel like I'm a person with grit, but it's one of the hardest things I've ever done.
Yeah, all of y'all are amazing. I mean, I have a lot of help. My husband stays at home, works at home, but he's home, so, during the day, so he sees my daughter a lot. But yeah, I don't know what I would do if y'all have a lot of strength. I give you that. And stamina.
Amy, do you have any last comments, or Maria?
I mean, I think Amy and Sheila had pretty much wrapped it up. I think it's a lot about being flexible and not being afraid to compromise. I've had to compromise on how clean my floors are or who I let do my laundry, because that's one of my pet peeves, and give some of that up so I can maximize the time that I have with my family and at home, when you can put work aside a little bit. So it's a balance, and there are many different ways to do it.
I would echo that. I just want to thank all three of you for coming on the show and being so honest and, really inspiring. Honestly, it's great to see so many women taking on the challenge, and I would never deter any young woman from doing that. I think children are a blessing. They're expensive, but there's nothing better than like your little child giving you a big hug. And you can't pay for that. There's just nothing better than that, right? So I'm all for that.
Well, thank you so much, and enjoy your evening with your kids.
Thanks for having us. Bye.
All right, bye.
Bye.
Take care.